Last name Star. Hi. Good morning. My name is Miss Puff. I'm a medical assistant working with Dr. Pearl. We're trying to be this way. I'm going to grab your weight. So you can step on the scale whenever you're ready. Okay, you can step down 130. And then can you put your back against this so I can just grab your height? Okay, 6'2". Okay, perfect. You can follow me to the exam room. We're going to be in exam room 6. Questions today, going through your chart, making sure we have everything, and then I'm kind of going to get why you're here today. So first things first, can you confirm your date of birth for me?
August 17,
1985. Okay, so that makes you what, 40 years old, is that right? Yay me for math. All right, and then any allergies to report?
No allergies.
No allergies, great. And then any past medical history for you that we should know about?
I have Marfan syndrome.
Marfan syndrome?
Yes. I also had a heart attack a year ago.
You had a heart attack a year ago. Any surgeries from that heart attack?
No surgeries.
No surgery, so it was a minimal heart attack then? Okay, good. Thank God for that. Any other surgeries that we should know about? No. And then any family medical history that's relevant today?
Well, I have a history of heart problems in my family.
Heart problems?
And hypertension.
And hypertension.
My dad actually has Marfan syndrome as well.
Okay, so family history of hypertension and heart problems, and then your dad has Marfan's as well as you. Okay, perfect. And then any alcohol use?
I drink a couple beers every night to help me pee.
To help you pee? Okay, that's interesting. And then any recreational drugs?
No recreational drugs.
No, good. Say no to drugs. And then, do you smoke or anything?
I do smoke cigars occasionally.
Cigars, but no cigarettes or vapes or anything like that?
Cigarettes, no.
Okay. And then, do you exercise at all?
I used to, but I've found that I get chest pains a lot when I'm on the treadmill and lifting weights and stuff, so I decided to work out a little more minimally, so I do a little light jogging around the neighborhood occasionally.
Okay, perfect. And then, are you taking any medications?
Aspirin.
Just aspirins?
Yeah.
Okay, perfect. And I'm assuming that's the low dose aspirin?
Yeah.
Okay, perfect. All right, well, now that we went through all the logistical stuff, what brings you in today?
Having really bad chest pain. It's been really bad up in here, but also it's been in my back as well. Also been very lightheaded and dizzy.
Okay. Well, you said some chest pain, so I'm going to ask you some of our cardiac screening questions. So, are you also having any like palpitations or anything?
What is palpitation?
So, palpitation is just like anything that's causing like a heartbeat issue. If you notice like anything different with your heartbeat.
I sometimes feel like my heart skips a beat.
Skips a beat. Okay.
Yeah.
Okay. And you just said you're lightheaded and dizziness. Any fatigue? Fatigue. Okay, you've been feeling like really tired lately.
Yeah.
Any nausea or vomiting? No. Good. And then any shortness of breath?
When I work out.
When you work out?
Yeah.
Okay. So some dyspnea on exertion. Okay. All right. Well, now I have all that in. Do you mind if I take your blood pressure? Okay. Perfect.
Should I roll this?
It's fine. We'll just do it down. All right. So I'll put the cuffs on. Okay, well your blood pressure was 88 over 54, so a little low. Let me just check your O2 sats and your heart rate. Can I just have one of your fingers, please? Thank you. Sometimes it's a little slow, just give it a second. Okay, looks like your O2 sats are 97 and your heart rate's 44. Okay, are you feeling lightheaded or dizzy right now or anything? A little bit?
Yeah.
All right, well let me go talk to the nurse and then the doctor should be in shortly, okay? Nice to meet you, Mr. Starr.
Nice to meet you.
Hi, Nurse Sandy.
Hey, how you doing?
Good, ready to go home for real. But I have a patient in exam room 6, and his heart rate was really low. It was 44.
Okay.
And then also his blood pressure was 88 over 54.
Yeah, that is really low.
I know, right?
What arm did you take it?
I took it on the right arm.
Yeah, I'm gonna go ahead and check that just to see if it's consistent. But I'm gonna do the left arm this time.
Okay.
And we'll see what happens.
Okay, yeah, let me go. Let me introduce you to the patient.
welcome.
Hi, Mr. Starr. This is Nurse Sandy. She's going to be rechecking your blood pressure just to make sure you know everything's consistent, okay? You're in good hands. Don't worry.
Hi, Mrs. Starr. How are you?
Doing well.
All right, so we're gonna go ahead and check your left arm because when we check your right arm, your blood pressure was a bit low. We're gonna check this arm again just to make sure you mind rolling up your sleeve for me. Okay, yeah, this is definitely higher. It's a 96/60. So we're gonna go ahead and get the doctor in here and she's gonna check you out just to make sure you're okay, all right?
Hi, Dr. Pearl. We had a patient in exam room 6 today. He's having some really questionable vitals today. So his blood pressure was 88/54 in his right arm, and I had Nurse Sandy check.
Yeah, and when I checked his left arm, it was actually a 96/60. So it was higher and we're kind of concerned about that.
Yeah, so I'll give you the patient rundown. So he also had a heart rate of 44. I mean, his O2 was 97, practically normal. He has a past medical history of Marfan's and heart conditions. He said that his dad also has Marfan's, and that he has heart problems and hypertension in his family. He hasn't had any surgeries. He drinks beer to help him pee. Have you ever heard of that?
No,
I know, right?
interesting.
Yeah. Also, he's not using any drugs, but he does smoke cigars occasionally. And then he did say that he was having like chest pain when exercising, and he takes aspirin. But his main complaint, like why he came in today, is like he's experiencing a lot of chest pain and dizziness and lightheadedness, and so he just kind of wanted to be seen.
Got it.
Hi, Mr. Starr. I'm Dr. Pearl. How are you?
Okay.
Okay, so I saw that you came in for chest pain, dizziness, and you have Marfan syndrome. Okay, so you had a heart attack a year ago and you've been taking aspirin since, is that correct?
Yeah, since the heart attack, yes.
Okay, so the nurse and the medical assistant told me that you've been having heart palpitations. What does that feel like? Is it a flutter?
It's like a skipping, like a flutter, skipping beats.
Skipping a beat?
Yeah.
Okay, and you've been having chest pain too?
Yeah.
Okay, how bad is that pain on a scale of 1 to 10, would you say?
I would say a 7.
A 7,
Yeah.
okay. And what does that pain feel like? Is it a dull pain, or sharp pain, or like a tearing sensation?
It's like a tearing sensation. Yeah, I would say
Okay.
that.
And where is that pain?
It's right in my chest, right up in here.
In your
It
chest?
also has been affecting my back a little bit as well. I don't know if that's related, but
Okay. And then I also heard that you've been having issues peeing. How long has that been happening for?
it's been happening for about a couple of months now.
A couple of months?
Yeah.
And when you do pee, what color is the pee? Is it like a clear, a yellow, maybe a darker yellow,
It's
or
like
brown?
a darker yellow, reaching brown. Yeah.
It's reaching brown?
Yeah.
Okay, and then are you able to pee less when you do pee? Is it less volume?
Yeah, it's been less.
Okay, and then, so you also said that you've been having lightheadedness. and
Yeah,
dizziness
it's been getting worse since I've been here.
since you've been here. Okay.
Code Blue!